Hi, I'm Dr. Keith Volstad.
And I'm Laura McLeod Volstad of Volstad Chiropractic and Integrated Wellness. We are located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. And our telephone number is 746-4242. We'd like to welcome you to this week's edition of the Chiropractic Corner, a weekly show spotlighting the chiropractic profession and what doctors of chiropractic do to improve their patients' health. In this program, Dr. Volstad and I plan to cover topics that pertain to your health from a complementary and alternative medicine point of view. These topics will include spinal injury issues like neck pain, low back pain, bulging discs, pinched nerves, and sports injuries, lifestyle medicine, dietary and nutritional advice, nutraceuticals, and supplementation, just to name a few. We'd like to encourage you to email us about topics that you'd like to hear discussed on this program. You can do that by emailing us at imchiro1, the number 1, at gmail.com. That's M as in Mary, CHIRO, the number 1, at gmail.com. And welcome again to the Chiropractic Corner. Over the last couple of weeks, we've talked about pain in general areas of the spine, neck pain, and low back pain. I think a good way to continue this type of discussion is to maybe be a bit more specific. That is, to talk about one specific cause of pain that can occur in both the neck and the lower back. The one that I thought would be interesting to our listeners, Doc, and is a very common cause of the pain in the neck and the low back, as you well know, is disc injury. From my experience in the office, Doc, I know that people who have this type of injury are very often in severe pain. They often are crooked and can't stand up straight. They have a hard time getting out of bed and moving around, right? Or they might have numbness and tingling down their arms to hands and their fingers. So can we explain to our listeners the ins and outs of this very painful and rather debilitating type of injury?
Good idea, Laura. Let's start by explaining a little bit more anatomy.
Oh, more anatomy?
Yep.
Okay, let's go.
Whether the disc is in the cervical spine,
that's the neck, right?
Right, or in the lumbar spine, and that's the low back, the anatomy of the disc is pretty much the same. Think of a jelly-filled hockey puck. The disc is a circular structure that is shaped kind of like a hockey puck.
Right.
The outer portion of the disc is made up of a fibrous material that's very tough, and it's known as the annulus fibrosus. It has a lot of collagen in it, and not much water. The collagen is a material that's used as a matrix to make bones and ligaments and tendons and so forth. The annulus also has 20 or so concentric sheets of this material that we've called collagen that are arranged in a specific circular pattern so as to make the annulus very strong.
Why does that structure have to be so strong?
That's a good question and leads us to the second part of the disc called the nucleus pulposus. This is the jelly filling of the hockey puck. The nucleus pulposus is a gelatinous material and has a very high water content. Why, you might ask? This part of the disc has two functions. Function number 1 is to support and bear the weight of the head in the neck and the body in the lower back. And 2, to act as a pivot point from which all movement occurs. Now back to the question as to why the outer portion of the disc must be so strong. It's because the nucleus pulposus is under so much compressive force from the weight and stress placed on it that it wants to spread out. Well, the annulus fibrosus keeps it contained in a centralized position so that it can perform its function like it should. That is, to bear weight and to provide you, the patient, with normal function. So every time you twist and turn and bend, remember it's the nucleus pulposus that's serving as a pivot point for all of these motions, and it's the annulus fibrosus that keeps everything intact.
Sounds kind of complicated. I imagine if we could see a picture of it, it'd be easier to understand, but this is radio, so hopefully folks can picture it in their minds. So now that we have the anatomy under our belt, how does this one part of the spine cause people so much pain, Doc? I mean, we've had patients with disc injury and they are almost completely disabled. I mean, just in tears when they come into our office. Where does all this pain come from?
Well, you're right, Laura. This is a very painful experience for patients. Folks that have these types of disc injuries, whether in the neck or the low back, experience an excruciating amount of pain. That's why they stand kind of crooked, or why they may hold their head in a special way, because they're in so much pain that if they try to straighten it up, it just sends them through the roof.
Yeah, we've seen that.
But if you remember, and one understands the anatomy that I described earlier, and then adds in the knowledge of the surrounding anatomy of the spine that we've talked about before, then understanding where this pain comes from is really made a lot easier. So Laura, if I were to ask you, where does pain come from? Your most likely answer would be...
from nerves?
And you'd be right.
Yay, I got one.
The nerves in our body are the things that carry messages from one area of our body to the brain. So when you've got an insult in the body, like an injury, it's the nerves that carry that message of pain from the insult in our body to the brain. These types of nerves that carry these impulses are called sensory nerves. Sensory nerves carry messages about position, about temperature, touch, pain, and pressure from the periphery, that is the outer portion of our body, to the brain.
Okay, hold on. You said something about, quote, knowledge of the surrounding anatomy of the spine, unquote. What other things are involved in the pain that people feel when they've injured a disc in their spine? Doesn't the disc hurt? Isn't it the disc that stimulates the sensory nerves to cause the pain?
Interestingly enough, the answer to that question is no, the disc itself doesn't really hurt. It doesn't cause pain itself. This is because the disc doesn't have a lot of nerves running through it or to it. It also doesn't have a lot of blood vessel running to and fro. So because of that, it doesn't really elicit a lot of pain, even though it's bulging and injured.
Okay, then where does the pain come from? And why do we concern ourselves with the disc if it isn't the direct source of pain?
Laura, you've hit on the crux of the situation when you said direct source of pain. The disc itself isn't the direct source of pain.
Okay.
However, understanding that a disc, when injured, can cause insult to surrounding structures, then we can see where the pain comes from. In the anatomy of the spine, nerves exit the spine through the intervertebral foramen.
Oh, there's that structure we've heard in previous editions of the Chiropractic Corner. It means holes between the vertebrae, right?
Laura, you are such a good student.
Yay, me!
You are absolutely correct. So the nerves that exit the spine in those holes lie right next to the disc. So simply put, when the disc bulges, it can apply a direct pressure on the nerve, which then causes pain. And by the way, there can be other neurological symptoms as well. Some people can experience not only severe pain, but they can have numbness, they can have tingling. We call that paresthesia. Or they may also experience some weakness in the associated extremity. Arms and hands for the neck, legs and feet for the low back. It is not uncommon that a patient who has a herniated disc will also have an associated weakness in their lower extremity. They'll say things like, my leg or my knee gives out, or I just can't seem to support my weight like I should. And one last thing, the bulging disc can cause a narrowing of the spinal canal.
Oh, is that stenosis, another word we defined last week, right? Meaning narrowing, as you just said.
Laura,
right?
You are awesome. You're remembering everything.
Oh, you be, Chama. It's just that you're such a good teacher, and it helps to be working with it every day. I'm starting to pick up all these terms.
Well, that's good to hear, and I hope our listeners are picking up on it as well. So yes, stenosis. And this stenosis, whether in the neck or the low back, can cause a number of neurological problems, of which pain is one, and that pain can be pretty severe.
All right, you've told us the disc can bulge and how the bulging disc can cause pain. Now let's bring it home. Can you tell us what happens to cause the disc to bulge? I mean, if it's so strong and tough, how does it get injured? It seems to me it must take quite a bit of force to damage the disc.
That's another great question, Laura. Let me try to put it simply so we can all understand.
I'm just full of those today, aren't I?
What happens is the outer part of the disc, remember folks, we call that the annulus fibrosus, can develop cracks most commonly through wear and tear. Then some type of insult occurs which causes a compressive force to be placed upon the disc. Things like an accident or a fall, or maybe even something as simple as bending over to pick something up off the floor.
Oh, you're right. I remember way back, I won't confess the year, my father, bless his heart, was just bending over to pick up a stack of books off the floor, and that was it.
Very commonly, it's the wrong thing at the wrong time type of mentality. And interestingly enough, it doesn't have to be a severe type of activity, but just the thing at the wrong time can cause that disc to go.
Yeah, and it's not age reliant either. He was only, oh gosh, how old was he? Around 40, 41.
There is truth to that. I mean, younger people can certainly blow out a disc in their lower back, but certainly the middle-aged folks seem to be most susceptible because their discs are still pliant enough that they can be injured. Then the older we get, the really older patients tend not to have so much of a disc injury because their discs now become much tougher, like a gristle piece of meat.
Okay. And I just, one more add to that. When my dad did that, it was, he didn't go to chiropractic care. It was just something that he didn't think of at the time. This is way back. I'm going back decades here. And he had several surgeries on his back up at Shands, the teaching hospital in Gainesville, and was never quite the same again. I wish he had gone for chiropractic care. He might not have had to go through all that.
Well, that's right. And interestingly enough, when we start talking about the treatment for these types of injuries here in a few minutes, we'll be talking a little bit about that.
Okay, thanks.
Okay, back to what happens to the disc itself. We have this compressive force that's placed on the disc through accident, injury, or insult, and then that jelly filling that we talked about earlier, the nucleus pulposus, is pushed into the cracks of the annulus fibrosus. And if that compression force is strong enough, that nucleus pulposus will push far enough into this annulus fibrosus, again, the tough outer shell of the disc, to literally cause a bulge on the outer edge of the disc. This bulge, then, is what creates all the problems that we just got done talking about. All that pain, numbness, and tingling, etc. This bulge, then, can cause that irritation, a narrowing of the spinal canal.
Question, Doc.
Yep.
How do you know when you've got that numbness and tingling in, running down your arms? How can you tell it's coming from your spine and it's not carpal tunnel or something associated with that?
A qualified physician can differentiate between the two. He can tell you whether it's a disc injury or whether it's carpal tunnel or some other type of nerve root entrapment. Not every injury certainly is disc. However, you need to be able to tell the difference.
And that's something that you can do in our office?
Absolutely. We have to evaluate patients for disc injury every day. Not always do patients come in severe pain when they have disc injury, although that is very common. Sometimes they'll have a disc injury and they won't be in severe pain. So it is important that we be able to tell the difference between disc injury and some other type of injury resulting in that numbness and tingling that you just mentioned.
Okay. So now we've diagnosed that it is a disc injury. The patient is in severe pain and they're standing kind of crooked. They've got numbness and tingling in the legs. What can we do about it? How do we help this patient?
The treatment that we would want to provide this patient is multifaceted. There are several things that we do for these patients from a conservative point of view. First off are the physical therapy modalities that we've talked about before. Things like interferential current, If you remember, interferential current is the utilization of an electrical current that reduces pain, helps reduce muscle spasm. So interferential current would be in order. We also would provide this patient most likely ice or cold therapy. Because of the disc being injured and because of the surrounding tissues being inflamed from the disc pressuring them, they're going to be very, very inflamed and swollen. So we would want to use ice to try and reduce some of that. And in doing so, help the patient have their pain relieved. However, if we see that the patient is in severe pain and we can't really get it to be lessened by the things that we do in the office, then certainly referring that patient out for a medical consultation to possibly get them some pain medication would certainly be in order. Let's talk about surgery real quick, because so often patients are either hurried into or think they need to have surgery when they have disc injury. I'm going to tell you that I would not recommend surgery right off. You need to try conservative management first, because if conservative management doesn't work for you, then you can always go to the surgical option. However, if you go to the surgical option first or right away and it doesn't work for you, there's not much hope that you're going to regain that functionality that you had prior to the disc injury. So things are permanently altered by a surgical intervention. However, certainly it is required at times, but it's always a second option in my opinion.
So how do you know when conservative management isn't getting the patient where they need to be? How long would you wait before you refer them out for a surgical consultation?
In my judgment, Laura, that really is more of a symptomatic resolution issue versus a time issue.
So different for everybody?
It's different for everybody. It just depends on how well they respond to conservative management. Mm-hmm. I will say this. I wouldn't wait more than a couple of weeks for the patient to respond before I would be sending them out. That's just too much time for the patient to be in pain. However, if the patient started to respond to care and we were seeing the improvement, then I would not refer them for surgical consultation. And
that means when, if they're responding to care, that means that their pain level is dropping.
Their pain level is dropping. There's some of their neurological symptoms are improving, not necessarily completely gone,
right,
but certainly improving. The key here, in my opinion, is seeing improvement in the patient's status. Now, getting back to the care of the patient from a conservative management point of view, one of the best modalities that I think that can be used for patients who have disc injury is spinal decompression.
Spinal decompression sounds like a surgical procedure, to decompress something, but you're telling us that's not surgical in nature.
No, spinal decompression is not surgical in nature. Basically, spinal decompression is computerized traction. And this is important because we can be very specific in controlling what we do relative to the patient's spine. And here's how it works. The patient is strapped onto a traction table. The straps are then connected to a computerized traction unit, and then a specific amount of force or weight is programmed into the computer so that the computer then can provide the type of and amount of traction that we require.
But isn't the disc injured or bulging? Wouldn't this injure it more or make it feel worse by distracting it?
I can understand where you might think that, but no, this therapy is just what the doctor ordered. No pun intended. Mm-hmm. What happens is the computer tractions the spine to the degree or force that we've prescribed and holds it there for about a minute. The computer then relaxes the traction to about a 60 to 80% of the original force and holds it there for an additional 15 seconds. Then increases the traction back up to the 100% force that we talked about a minute ago. And this goes back and forth for a 15-minute treatment time. This creates a kind of milking action to the disc that research has shown can reduce the bulge of the injured disc. But remember, Healing doesn't occur immediately. You're not going to have immediate resolution of this disc bulge. Most injuries require a number of visits, and that number is determined by the severity of your injury and by your ability to recover.
When we do this with patients, I know you can almost tell when they feel that relief. You know, when you get 20 to 30 pounds of destructive force or pull on that, it's just like their whole face just relaxes. It's like, oh, out of pain or greatly relieved when we do that.
That does happen very often with spinal decompression. They will have a relief of pain while they're on the table. Unfortunately, because disc injuries don't go away immediately, what happens is when that force is relieved, in other words, when the modality is finished, the patient very commonly is going to hurt again. And that's why treatment is required on an ongoing basis over a period of time, because it takes that much time for the disc to be reduced and the patient to have recovery so that they don't have the symptoms.
So what's the physicality of that? You know, when you're distracting the disc and that bulge, it kind of, I'm picturing it in my mind as, okay, the disc juice, you know, is able to just kind of get sucked back up between the spine where it's supposed to live. And
what happens is when you distract the spine, you're accurate in describing it like pulling on the two sides or two ends of the disc, and in fact it does retract the nucleus pulposus out of the crack like we described earlier, back into the central portion of the disc, or more so into the central portion of the disc, thus allowing the disc to have an opportunity to maybe start to heal itself. And this must be done over a period of time because the disc doesn't heal real quickly. If you remember earlier, we talked about the fact that the disc doesn't have a lot of innervation, that is, many nerves going to it. It also doesn't have a lot of blood vessels running through it. And because of that, the healing time is greatly increased versus other structures in your body that have a lot of vascularization, like a muscle. And also just want to repeat one thing, that when you do go through spinal decompression, don't forget we're also providing those physical therapy modalities. Those two are also involved in relieving the patient's care, or relieving the patient's pain, excuse me.
So we put you on the rack first and pull you apart, and then we send you in for more therapy to give you that unattended massage, that EMS that everybody loves so much.
That's correct. And
that's why we do it that way.
Yeah, one last thing. Since we are a conservative facility, we don't utilize drugs or surgery, we have come across natural supplements that can help a patient in pain and help reduce their inflammation. I'm talking about natural anti-inflammatories. We utilize these in our office as well. So patients very commonly will be instructed on how to utilize that.
Okay, Doc, I think that we're going to have to wrap it up there for another edition of the Chiropractic Corner. Dr. Volstad and I would like to thank you for listening, and we'd like to invite you to ask questions, share your thoughts with us. Please feel free to email us again at imchiro1@gmail.com. Again, we're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. And our telephone number is 561-746-4242. And now on to the tip of the week. Doc, what's up this week? Got a good one.
Do you like pineapple?
Yes, I do. Love it. Fresh pineapple.
Here's why you should eat pineapple.
Okay.
It's rich in fiber and helps regulate digestion, as it contains and acts as a natural enzyme. Pineapple also contains calcium, phosphorus, potassium, and manganese, as well as vitamin A and C. It neutralizes acidity and can reduce the pain of arthritis. So make sure you make pineapple a regular part of your diet.
And did you know it's so easy to grow your own pineapple?
I didn't know that.
Yeah. Here's how you do it really easily. When you all go to the grocery store and buy that pineapple with the top on it, and you cut the top off, as you're beginning to peel your pineapple, save the top and just go set it outside in your garden, either in full sun or in part sun. It'll even take, 50% shade during the day. And in a couple of years, that pineapple top will grow into a pineapple, but it will take 2 years. It's part of the bromeliad family for all you horticulturalists out there. So just be patient, and in a couple of years, you'll have your very own homegrown pineapple.
Thanks, Laura. And folks, I'd like to remind you to Google our website at Volstead Chiropractic. And for those of you that are on Facebook, search for our Facebook page at Volstead Chiropractic and like our page. Join us next week for another exciting edition of the Chiropractic Corner, right here on WJUP, The Jupe, 103.9 FM. We're on Saturday and Sunday mornings right after the 10:30 news. Until then, be well, live well.